Remote monitoring, enabling continuous care and patient autonomy. Overview. Remote monitoring technologies enable healthcare providers to track patients' health status and vitals in real time, outside of traditional clinical settings. This technology allows for continuous care and provides patients with more autonomy over their health management. Key topics: definition and importance of remote monitoring. Remote monitoring uses digital devices and wearables to collect health data, such as heart rate, blood pressure, glucose levels, etc., from patients at home, which is transmitted to healthcare providers for analysis. Types of remote monitoring devices. Wearables. Devices like smartwatches and fitness trackers that monitor vital signs and physical activity. Home-based devices. Equipment for monitoring specific health conditions, e.g., glucose meters, blood pressure cuffs, pulse oximeters. Mobile health apps. Applications that allow patients to track symptoms, medication adherence, and other health metrics. Benefits for patient experience. Improved autonomy. Patients can manage their health in real time, receiving alerts and feedback without needing to visit the doctor frequently. Continuous care. Healthcare providers can monitor patients' conditions between visits, ensuring proactive care and early intervention for potential complications. Convenience and comfort. Remote monitoring reduces the need for in-person visits, providing patients with the flexibility to receive care at home. Challenges. Ensuring accurate data collection and avoiding technical issues with devices. Addressing privacy concerns with the transmission and storage of health data. Ensuring that patients are properly trained to use the devices and apps. Virtual care platforms. Breaking barriers to access and convenience. Overview. Virtual care platforms offer a digital solution to healthcare delivery, enabling patients to receive consultations and treatments remotely through video calls, messaging, and other virtual communication tools. These platforms eliminate barriers to access, such as distance, time, and mobility, while increasing convenience for patients. Key topics: definition and types of virtual care. Telehealth, real-time video or phone consultations with healthcare providers for diagnosis, treatment, and follow-up care. Telemedicine, similar to telehealth but often used for more specialized consultations, particularly in rural or underserved areas. Asynchronous virtual care, the use of messaging, online questionnaires, or digital submissions of patient data for remote assessment and treatment without the need for real-time interaction. Key features of virtual care platforms. Video consultations, allowing patients to have face-to-face consultations with doctors from the comfort of their home. Secure messaging and email, enabling asynchronous communication between patients and healthcare providers for non-urgent matters. Virtual prescriptions, allowing healthcare providers to prescribe medications based on virtual consultations, which can be sent directly to a pharmacy. Care. Coordination. Platforms that integrate with EHRs and other healthcare systems, ensuring seamless coordination of care between virtual and in-person providers. Benefits for patient experience. Increased accessibility. Patients can access healthcare services regardless of location, particularly beneficial for those in remote or underserved areas. Convenience and time saving. Virtual care eliminates the need for travel, long wait times, and time off work. Protecting patient privacy, compliance with HIPAA and GDPR. Overview. This lecture addresses the critical importance of protecting patient privacy in the digital health landscape, focusing on two key regulations: HIPAA, Health Insurance Portability and Accountability Act in the US, and GDPR, General Data Protection Regulation, in the EU. These regulations are designed to ensure the confidentiality and integrity of patient information in the digital age. Key topics: HIPAA compliance. Purpose: HIPAA is a U.S. law that mandates the protection of sensitive patient information. Healthcare organizations must adhere to strict guidelines regarding the collection, sharing, and storage of patient data. Key provisions: ensuring patient consent for data sharing, implementing physical and technical safeguards to protect data, and limiting data access to authorized individuals only. Patient rights under HIPAA. Patients have the right to access their health information, request corrections, and control how their information is used or shared. Penalties for non-compliance. Organizations that fail to meet HIPAA requirements may face significant fines and legal consequences. GDPR compliance. Purpose: GDPR is a comprehensive privacy regulation that applies to all organizations handling personal data of EU citizens, including health data. Key provisions: GDPR mandates informed consent, transparency in data processing, the right to access and delete personal data, and data protection by design. Cross-border data transfers. GDPR includes provisions to protect patient data when it is transferred across borders, requiring adequate protection mechanisms. Penalties for non-compliance. Violations can result in hefty fines, up to 4% of global turnover, or 20 million euros, whichever is greater. Commonalities and differences between HIPAA and GDPR. Both regulations prioritize patient consent and data protection, but they differ in geographical scope, enforcement mechanisms, and specific privacy rights granted to patients. The challenges for healthcare organizations in complying with both regulations when handling cross-border data. Data security in e-health systems. Safeguarding patient information. Overview. Data security is essential in ensuring the confidentiality, integrity, and availability of patient information in digital health systems. This lecture focuses on the technical and organizational measures that must be taken to safeguard sensitive health data against breaches, cyber attacks, and unauthorized access. Key topics: importance of data security in e-health. Healthcare data is a prime target for cyber attacks due to its sensitive nature, making robust security measures essential to prevent breaches and unauthorized access. Security risks in e-health systems. Cyber attacks, including ransomware attacks, phishing, and hacking incidents. Data breaches. Unintentional leaks or access to patient data by unauthorized individuals. Insider threats. Employees or contractors with access to sensitive data who misuse it. Key security measures. Encryption. Encrypting patient data, both at rest and in transit to prevent unauthorized access during storage or transmission. Access controls. Implementing role-based access controls, RBAC, to limit who can access sensitive information based on their job function. Two-factor authentication, 2FA. Adding an additional layer of security for accessing patient records and systems. Data backup and recovery. Ensuring systems are regularly backed up, and a disaster recovery plan is in place in case of cyber attacks or system failures. Regular security audits. Conducting ongoing assessments of security practices to identify vulnerabilities and mitigate risks. Healthcare-specific security standards. High-Tech Act, the Health Information Technology for Economic and Clinical Health Act, which encourages the use of electronic health records while ensuring secure handling of patient information. ISO IEC 27001, an international standard for information security management systems that can be applied to healthcare organizations. The role of healthcare professionals. Educating healthcare providers and staff on the importance of data security and their role in safeguarding patient information. Addressing digital health disparities. Equity in access to e-health solutions. Overview. This lecture explores the ethical challenges surrounding digital health disparities, focusing on how unequal access to e-health tools, such as telemedicine, remote monitoring, and patient portals can impact vulnerable populations. Ensuring equity and access is critical for the success of patient-centric e-health solutions. Key topics: digital health disparities, barriers to access, disparities in access to technology, e.g., smartphones, internet connectivity, digital literacy, and socio-economic factors that affect certain populations, e.g., rural communities, elderly, low-income groups. Health inequities. Lack of access to digital health solutions can exacerbate existing health disparities, leading to poorer health outcomes for disadvantaged groups. Addressing the digital divide. Access to technology. Ensuring affordable access to necessary devices and high-speed internet, especially in underserved areas. Digital literacy. Providing training and resources to help patients navigate digital health tools effectively, including telemedicine consultations, patient portals, and health apps. Culturally competent solutions. Designing e-health tools that are accessible and relevant to diverse populations, including translating materials into multiple languages and addressing cultural preferences. Ethical considerations. Ensuring equal access. Healthcare organizations must proactively address digital health disparities by offering alternatives, e.g., phone consultations, for patients without access to digital tools. Privacy and security for vulnerable populations. Vulnerable groups may be more susceptible to privacy breaches, so enhanced protections for their data must be implemented. Role of policymakers and healthcare providers. Inclusive policy development. Governments and healthcare organizations must create policies that promote digital health equity, ensuring that underserved populations are not left behind. Community outreach and education. Healthcare organizations can partner with community groups to help increase digital health literacy and support equitable access to e-health services. Improved care continuity. Virtual consultations facilitate ongoing care and follow-ups, helping patients stay on track with their treatment plans. Challenges. Technology barriers. Patients may face issues with internet connectivity, device access, or lack of digital literacy. Privacy and security. Protecting patient data during virtual consultations and ensuring compliance with privacy regulations, e.g., HIPAA. Limitations in care. Some conditions may require in-person examinations, and certain medical services cannot be fully delivered through virtual platforms. Trends and innovations. Shaping the future of digital health. Overview. This lecture explores the emerging trends and innovations in digital health that are likely to shape the future of patient care. These innovations have the potential to enhance the accessibility, efficiency, and personalization of healthcare, with a focus on improving patient outcomes and experiences. Key topics: artificial intelligence, AI, and machine learning in healthcare. AI-powered tools are being developed to assist with diagnosis, treatment planning, and personalized care, making healthcare more efficient and accurate. Predictive analytics, using data to predict patient outcomes, risk factors, and the likelihood of disease progression, allowing for proactive care. Natural language processing, NLP, leveraging AI to extract meaningful insights from clinical notes and patient interactions, improving decision-making. Wearables and remote monitoring devices. The growing adoption of wearables, e.g., smartwatches, fitness trackers, allows for continuous health monitoring, enabling real-time feedback and personalized care. Health data integration. Wearables that seamlessly integrate with EHRS and telemedicine platforms, providing a comprehensive view of a patient's health. Telemedicine and virtual health. The expansion of telemedicine platforms, offering not just video consultations, but also remote diagnosis and virtual therapies, reduces barriers to access. Global expansion of virtual care. The trend toward providing healthcare services across borders through telemedicine, improving healthcare access in remote or underserved regions. Blockchain for healthcare. The potential of blockchain technology to enhance data security, privacy, and interoperability in digital health systems. Patient data ownership. Blockchain could allow patients to have more control over their health data, determining who has access to it and how it is shared. Personalized medicine. Advances in genomics, pharmacogenomics, and other technologies are paving the way for treatments tailored to individual genetic profiles, enhancing outcomes. The integration of genomics into digital health platforms allows for more precise and targeted therapies. Robotics in healthcare. Surgical robotics. The growing use of robotic-assisted surgery allows for more precise, less invasive procedures. Robotic care assistance. The potential of robots to assist with elderly care, helping patients manage chronic conditions or age-related illnesses in home settings. Integrating e-health with traditional healthcare practices for seamless care. Overview. This lecture focuses on the integration of digital health solutions with traditional healthcare practices to create a seamless care continuum. By combining the strengths of both approaches, healthcare providers can offer more coordinated, efficient, and patient-centered care. Key topics: benefits of integration, continuity of care, the integration of EHRs, telemedicine, and remote monitoring into traditional healthcare systems ensures that patient information is accessible across all care settings, reducing errors and improving coordination. Holistic care. Combining digital health tools with in-person care allows for a more comprehensive approach, addressing both physical and mental health needs of the patient. Timely interventions. By integrating remote monitoring and telehealth with regular in-person visits, providers can intervene earlier when issues are identified, preventing complications and reducing hospital admissions. Strategies for integration. Interoperability of systems. Ensuring that e-health systems and traditional health systems can communicate with each other effectively, allowing for the exchange of data in real time. Unified patient records. Ensuring that all patient data, whether gathered in person or remotely, is stored in a single, accessible system that is regularly updated. Collaborative care models. Encouraging a team-based approach where digital tools are used to support in-person consultations and the overall care process, rather than replacing traditional practices. Overcoming challenges. Resistance to change. Healthcare providers and organizations may be hesitant to adopt new digital tools, especially if they are not familiar with the technology or perceive it as disruptive to established practices. Data privacy and security. Ensuring that digital tools comply with regulations like HIPAA and GDPR while integrating them with traditional systems. Training and support. Providing ongoing training for healthcare professionals to ensure they can use digital health tools effectively while maintaining traditional care approaches.